So, welcome to this episode of Menopause Conversations. I'm really excited to have my next guest, who I had the pleasure of meeting and also having a go at one of the devices that they use at this clinic. I am delighted to welcome my guest, Kate Fox, who is the clinic manager at the Nantwich Clinic in Cheshire. Hello, Kate. Lovely to see you.
Hello, Amantha. Thank you for having me. It's really great
Oh,
to be here.
oh no, you're welcome. We've been trying to get you on for ages. And we want to talk about a topic today that I think is particularly shrouded in silence, stigma, possibly taboo, and it's the topic of incontinence. It's something that people definitely don't want to disclose, and yet it's something that a lot of women are having to, what I would say, manage on a daily basis. When I think about how big my bag is for work, it's because it's all the little gadgets and creams and pills and potions and various things that I might need in case I have an accident, i.e. menstrual flood or something, if I'm just managing my symptoms. And I was just showing Kate, I never leave home without my localized estrogen cream. Because, as we're going to talk about, the sensitivities around women's vulval areas, how that connects to their bladder, and actually how it can cause really, really uncomfortable symptoms. So, I'll get my model out. We're going to be talking about this region here and backwards, which is about, actually our urinary flow, what happens during perimenopause and menopause. So, and Kate's brilliant because she's here to help us understand and connect all of those dots with menopause. So, Kate, let's get straight into it, shall we? Let's talk about, what exactly is incontinence and how's it linked to menopause, particularly sort of perimenopause, postmenopause?
Yeah, okay. So we normally describe incontinence as sort of the involuntary loss of control, whether it comes to urination or defecation. We do tend to talk more about urinary incontinence, but there definitely is an aspect of fecal incontinence as well. So we're more focusing on the urinary incontinence side of things today. So um, it's linked to the menopause just because we go through so many physiological changes, including hormone alterations, and all of these things, they go together and they just mean that our pelvic floor just isn't what it was, and our urinary function just wasn't what it was when we were not menopausal. Um, I think it's that loss of estrogen as well that can really take into a big effect with our incontinence issues.
Yeah, because it's a complex plumbing system, isn't it? When we think
Yeah,
about everything that's happening, everything's in close proximity here. And so it makes sense, doesn't it, that actually, if this is highly estrogenized, and we've got a cavity here, in the back, our womb, our cervix, and the bladder is up on top. As things start actually aging and there is a depletion of those available hormones, that things are going to take place. I mean, I don't mind sharing that when I first started to get perimenopause, I did actually notice the biggest, most significant changes were in my bowel, you know,
right.
and I noticed that I started going more regularly. Everything was a little bit more loose for me, feeling like actually it started to worry me. But the longer it went on, I thought, oh, okay, this is just my new normal. And I did get myself checked out because that, any change in bowel habit, we should be really getting investigated, shouldn't we?
Absolutely.
Yeah,
Yeah.
so you're absolutely right. So we know that there are very powerful connections between the ladder, bladder, and the outside world. So we need to sort of be paying attention to that. So there are different types of incontinence, aren't there? Could you gently take us through what the different types are so that people listening to this will be going, okay, that could be me.
Yeah, so I would normally say that there are five types of incontinence that we can be looking at when we're focusing on particularly urinary incontinence. So we've got stress incontinence and urge incontinence. They are typically the most common two that you'll come across. So stress incontinence it's mainly when it's you're running or your physical activity, you're coughing and you're noticing that there's some leakage during that type. So that extra pressure is causing some leakage. And then urge incontinence is a very sudden and intense urge to urinate, and then it's followed by some involuntary leakage. So they're the two most common one. And then kind of a third one is mixed, and that is typically urge and stress that we mix together. And it can be more than the two types. It can be some of the other options as well. But your most common option with mixed incontinence is that it's stress and urge. We've also got overflow, and that's when the bladder isn't emptying completely. So you're having some dribbling from that. And then the final one is functional. So it can be physical or mental impairments that prevent you from reaching the toilet in time. But it can also be in conjunction again with the mixed side of things where you have other issues with your pelvic floor in play. It's not just potentially like an arthritic hand, so you can't undo your jeans fast enough. It's not having a stronger pelvic floor might help you in that scenario as well. So there's lots of different ways that you can struggle with it.
Yeah, and I hear a lot from people, and I know this from close friends who maybe have had a hysterectomy, for example. We understand that, this cavity then changes in its form, doesn't it? If we remove
Yes.
something, under the force of gravity, and ligament stretching and things naturally aging, that's why women can start to notice these things. And I hear lots of people laughing it off, quite honestly. Like it's like, almost to expect it. And I sort of think, is that okay? Should we just be expecting that that's normal, Kate?
I don't think we should accept it. I think people also take it as part of getting older. They think, oh, it's because I'm older and you just have to live with these things. And you don't. There are so many different ways that you can work around getting something this done. And it's not to say that the first thing you should look at is having something as invasive as a surgery towards it. There are little daily things that you can do to help make your life easier so you don't have to accept these things. Um,
Yeah,
but
can I
yeah,
tell you what
it's
incensed?
really common.
Yeah, and can I tell you what incensed me the other night? I've said this the
Yeah,
second time in a week. I was watching my guilty pleasure, Your Mum, My Dad, Your Mum, that show, which I absolutely loved. And I sat with my husband, and because we were watching it real time, which we never do, we're always like fast
right.
forwarding, right? We're having to watch it real time. Right, 9:30, I'm sat there, and what comes up? A tenner lady advert.
Oh, yeah.
And I was like, hang on a minute, when we were just talking about people in midlife getting together, starting something amazing, and then like you slam that in people's faces. And I'm not saying that there's not a place for that, but what I'm saying is I think there's so much more available to us before we decide that that's our go-to.
Yeah,
Because
yeah, and it's not an easy solution. I think it's marketed as an easy solution, but having the 10 ladies, anything like that, it's incredibly emotionally stressful for people to use those things and it's draining. There's also a high cost associated to it and the environment.
well,
It's not good for the environment, not good for the planet,
and I don't
you
think
know.
they're terribly comfortable because if we come back to this, which is already going to be
Yeah,
lacking in estrogen, I always say to people, and you have to forgive me if it causes a bit of a laugh, but I always say, look, these lips are no different to these lips.
no, yeah.
It's the
That's why
same.
they're called lips. Yeah,
Exactly. It's one and the
yeah,
same thing. And so, actually, a pad rubbing across what is already an incredibly sensitive area. No thanks. I can honestly say, since stopping menstruating, now that I'm postmenopausal, I am so
yeah.
glad I don't ever need to go near one of those things ever again.
Because we've not discussed kind of like the microplastics, the pH, anything like that, that those pads will have an effect on. So your overall flora and your health down it's not helping that, it's not aiding that at all.
No, so let's
When
let's
using
get
the
into let
pads.
let's
Yeah.
get into that then. So let's talk about the everyday steps before we resort to that. And we're not saying that that's
Yeah.
not helpful in some cases. Okay, so
Yeah, it's definitely a good backup if you need it. It's something to be aware of that exists. It's not to
yeah,
say that there's never a place for it.
yeah, no, exactly. So what when we think about the practicalities of life, we're all very busy, we're all managing all sorts of things. What steps can people take to manage urinary incontinence before maybe turning to more invasive treatments? What do you think?
Yeah, so we were talking previously about like localized estrogen creams as well. That's something that I know you're a massive fan of, and rightly so.
Yes.
Um,
Can I just show people
and
where they would put that, just so that people do know?
absolutely,
Yeah, so here's
please,
here's my
yes.
cream. Literally, you take a small pea-sized amount and you put this cream can be inserted inside, not obviously with that. You get a syringe that would go inside. But actually, what you then also do is take a small amount and you literally put it over the entire outer surface, inner surface, and really think of it almost like that lip salve. And what we know here is the opening to the bladder right up there. And, when you take your estrogen in a patch or tablet form or as an implant, it's just like trying to get something to go to the South Pole. It rarely gets there. So that's why we need the localized stuff. And this can really help re-plump up, re-estrogenize the tissue. And this is so, so safe. It's not called HRT for this area. It's called localized estrogen. So that is a really powerful thing. And this is available on the NHS. This is called Ovestin. So, that's something you can do for yourself. And outside of that, there's even more that we can do for ourselves. So yeah,
Yeah,
carry on.
so just things like fluid management. Not, I think when you say fluid management, people immediately go to, oh, drinking less, not drinking before bed, but that is not the case at all. You should be able to go through your life drinking whenever you want to. You should be able to have a glass of water straight before bed, and you should be okay. A healthy pelvic floor will carry you through the evening. What I say when I mean fluid, what I mean when I say fluid management is it's more like, what are you drinking? Alcohol, coffee, carbonated drinks, these are all diuretics, they irritate the bladder. So being really mindful of what you're drinking, and whether you could just try drinking water instead to get that proper hydration. That
Yeah.
makes a massive difference.
Yeah. And does
Yeah.
it also ring true though, Kate, that actually like, so if we're keeping our bladder nice and full, we're also sort of telling it what to expect, aren't we? It's a bit like your stomach. If you only ever eat really small meals, your stomach shrinks, doesn't it? Does it work in the similar sort of way?
I think that's a bit of a thing. I always think about the habit management of bladder training. So when you scheduling trips to the bathroom, and you in getting your bladder used to being full, and used to not like constantly trying to empty itself, because it will train itself to always need to be emptied really, really frequently. So that they're a bit of two and the same in that, which was my next point anyway. So you jumped ahead, which is
Oh,
brilliant.
sorry. Go ahead.
You
Go ahead.
no,
Make
no,
that.
no, it's absolutely brilliant. But yeah, so that is that habit management. I think that's something that people can struggle with to start with, because if you've got that habit of going for like an emergency wee or a just in case wee, then it's so hard to break that, because you also think subconsciously, I need it. I'm going to be in a really difficult position if I don't go for it. But it's a very self-fulfilling circle, where if you go for it, then you will need it. Whereas if you don't go for it, then you won't need it as much. So
Yeah.
that's a big one.
Yeah, because we often
Yeah.
find in perimenopause, people will get an increased prevalence or experience of urinary tract infections.
Yes. Yeah.
And I know it's so counterintuitive, but you sort of think, oh my God, it's so painful every time I go. I just won't drink as much. But we know, don't we, Kate, that actually drinking more can help flush it
Yeah.
out. And, you rally in that way. But yes, it can feel
But you get all
painful.
the proper benefits from hydrating properly. It isn't for the whole of your body. If we think very holistically, you can't expect one area of your body to work if you don't nourish the rest of it.
No, good
It doesn't work
point.
like that.
Good point. So what other things can we do?
I would say something that we don't really talk about, is very difficult to talk about because it's quite a sensitive subject for people, but weight loss, any excess weight on it relieves the pressure. If you can lose any excess weight that you might have, it just relieves that pressure on the bladder. Because if you think of how our bodies are, your bladder and your pelvic floor sit right at the bottom of what's essentially our torso, and that carries all of the weight from our heads, our arms, everything. It takes on that strain. So any additional weight in there, if you can reduce it, then that will help improve
Makes se-
the
it
yeah.
makes sense. And during midlife, we obviously get that menopause belly.
Yeah.
So
And
it's all working against us, really, isn't it? Unless we take some
yeah,
control of it.
yeah, definitely. And again, I'm a big fan of pelvic floor exercise if you can do them properly. You can get pelvic floor therapists to guide you through them. I think sometimes that's the best way. Because if you want to make sure you're doing them correctly. But then once you've learned how to do that, and you've got that muscle to mind connection, you can just do it whilst you're brushing your teeth. Just
What are we
really,
talking about there? Raising and lowering our pelvic floor in those
yeah,
exercises.
yeah. So just if you can contracting and relaxing, and just actually getting your brain to focus on being able to engage that muscle, it takes a lot of concentration. I remember when I first started doing anything with this, I couldn't do them. Just I had to really, I wouldn't be able to talk to you now and do them, but
Oh,
now I can have a conversation and do
I'm
it now.
having a
At
go now whilst you're
yeah, I'm trying
talking.
to do it now as well. We see me zone out a bit.
So funny, isn't it? Like, yeah, I'll have a go, and try and
Yeah,
speak at
why
the same
not?
time, and try and speak at the same time. But these are all these little challenges we can give ourselves because the mind-body connection is so powerful, isn't it?
Yeah, yeah. And that mind's a muscle. It's a roadmap. If you don't if you don't use it, you lose it. It's the same as anything else. And it's
Yeah.
never really something that we are taught to use. So it does make sense that we will lose it if we don't engage it
Yeah, and
actively.
our whole pelvic area is like a cradle, isn't it?
Yeah,
And drawing up that muscle like a lift. I always remember my Pilates teacher talking about it, drawing it up. And actually our breath work, if we're largely sat, as I am for most of the day, like you say, everything's bearing down, isn't it? It's very difficult to
yeah,
breathe properly. And we know that actually our diaphragm connects to our pelvis, and so how we're
yeah,
breathing, everything's really affected, isn't it? So you're right. If people are really struggling with that, do check in. There are some amazing pelvic floor therapists, aren't
yeah.
there?
Yeah, and again, your abdomen and your core muscles, like you're saying, your diaphragm connects to it. If you can strengthen your core muscles, then that will help support the link between the two. Because I was thinking it like, like if you would say like the weakest link in a chain, if
Yeah.
that's what's damaging it for you. Because if you have had children and you have diastasis recti, where the muscles split apart in your abdomen, that will again have a weakness, which you'll need to fix and support it. And there are so many different things you can do with that. But it mainly does start with gentle at first, obviously, because your muscles have come
Yeah.
apart, but trying to re-knit those muscles
Well,
really makes a big
that's what happened
difference.
to me after I had my emergency cesarean, because it was all a bit of a rush job. Mine has not knitted back together, and so it's almost
Yeah,
like there's this shelf, like literally where my cesarean line is, and then there's just no tone at all
right.
because the muscles haven't knitted back together. So, doing any sort of exercise like sit-ups and stuff, it's like beyond me. I have to do all standing, like abdomen work, if that makes sense, or lying flat
Right.
on the floor, not trying to raise myself up because there's just no tone there at all. So everything you're
Yeah.
saying is making so much sense, about what we can do. So yeah, got those under our belts. What else can we be doing?
There's things that are a bit more invasive. I think but there's medicine as well. We haven't talked
Yes.
about medicine even, and that's such a big point too. You've got different ones for uh different kind of continences and different groups of people. You've got alpha blockers, which are very common for men because they're more likely to get overflow continence issues than a woman is, just how biology is. And that
Yeah.
helps to relax the muscle fibers so that they can get that improved urine flow. That's
Yes.
really good for them. And I can never say it's an anticholinergic.
Yeah,
I can
you
never say
said it.
it.
Brilliant. That's exactly it.
Thank you. And that's brilliant for urgent continence because they just help you to relax the bladder. And we've already spoken about topical estrogen, but for medications, they're the top three that I'm always thinking about.
Yeah, exactly. But again, it's in that order, isn't it? About strengthening
Yeah.
first. If it's not happening, then there's other things we can go in. So let's get into maybe more of like your area of furthered expertise. Obviously, you're very knowledgeable about all of this. When we talk about medical devices and maybe more invasive procedures, what could we then explore next?
So we at the clinic have some non-invasive technology that we can look at. But in terms of we're going down more the medical route, probably what most people would be looking at would be something like a Botox injection, which I know it can be very useful again, but it's relaxing the muscles in the case of urgent incontinence. So it might be that the medication isn't doing it for you. You've got contraindication, you can't have the medicine. Some people simply don't don't take medication, they choose not to, or they're having a bad reaction to it, they might be allergic to it. So then they would maybe be looking at the Botox injections. I would say there's quite a lot of pain associated with Botox injections. There are not many people qualified in it because it's a very specialist treatment that you can have.
Mm,
Um, and you have to have quite regular upkeep with it as well. It's sort of every 3 months you would be going to have another one, which for some people isn't feasible.
no.
But again, you get really good results because it's like you see people with their faces, but it's the same thing, just for your pelvic floor. So
Okay.
um, there's all sorts of different surgeries as well that you can have. They A big common one that I think people are aware of are having a plastic mesh inserted, and the NICE guidelines don't actually recommend that anymore. We're really moving away from the mesh,
Well, there
just
was a lot
simply
of
because
negative press about that sort of stuff quite recently, wasn't there?
yeah, it's come out quite recently, but there are a lot of people that I've met that have had the mesh and they're still having issues with it, simply because we're finding that it isn't the best thing to do anymore.
Right. Okay. Okay. So
Yeah.
what would they do instead?
We've had them in clinic on the Emsella on our pelvic floor device, so that's worked really well for them.
Yeah,
And again, we've had a lady that was told she could only have the surgery. There was nothing else that she could have that would help her. And again, it was the mesh that she was recommended. This was only about 8 months ago that she came in.
yeah,
And we spoke to her about the chair. She was the perfect candidate to have the Amsella. And she's had her course of treatment and she's thrilled with the results.
yeah.
And she's not had to have the surgery. So it saved her all that downtime.
Yeah. I mean, there's so much. You very kindly sent me lots
Yeah.
of notes about stuff. We've got minimally invasive procedures like you said, sort of said those bulking agents, the Botox injections. Tell me a little bit
Yeah.
about nerve stimulation then.
So it's that's an interesting one. It's less invasive, but it's there's a nerve in your ankle, your tibial nerve stimulation. You can have that stimulated, and that will help bladder control. It's
Wow.
not something that I'm massively knowledgeable about, simply because it's not something that I've ever done.
Yeah.
I have heard really good things about it. Yeah,
I'm
but again,
imagining, I'm
it's slightly
imagining
more invasive. Yeah,
Yeah, and I'm imagining it's sort of things, acupuncture, which works on pressure points and stimulation, I'm sure they'd had something to say about that. But I mean,
yeah.
let's come to it because actually we were invited by my mutual friend and lovely colleague June Potts to come and visit your clinic, and we actually had a go on the M seller chair. And I must admit, I mean, we made June go first obviously. I couldn't get her off it once she was on it. But talk to
For
us now
fun.
then a little bit about, and you told a beautiful story actually, which really I found really, really touching. And you can probably tell if you're watching this how lovely Kate is. And you can imagine just what a breath of fresh air she is. But you told us about some of the treatments that you're offering. You told a really nice story about someone with disability. And I just want to say, that we don't talk about disability and menopause anywhere near enough. And people who have disability have much, much more extreme symptoms than maybe people who don't have any disability. So I think that's a really important thing, particularly when we're in the workplace and maybe considering people in the workplace. Incontinence is something, just another thing people are having to manage. So tell us a bit about, well, you go first, whichever you want to do. Let's talk about Emsella. And
Yeah,
we've also
I
got
feel like
lots
we've
of other ones.
touched on that. So do you want to
Yeah,
carry on?
yeah,
Yeah.
keep going.
Yeah. Well, it was Amsella that the lady that we were speaking about when you came into the clinic, that was what she had. So she was I say well, she still is in a wheelchair. She has a degenerative condition, which means that she has carers with her. So she had the Amsella treatment and she noticed results throughout the course and she was just ecstatic, and it was so lovely to see, because at the start I did say to her, you have a degenerative condition, I can't, there's no white paper on this. If you would want to try it, I'm so happy for you to try it, because there's no other reason that she wouldn't be able to have it. But I can't say that you'll get the same results that we're used to experiencing. So she was just thrilled, but not only was she thrilled, so was the carer, because it was saving them time from going to the bathroom, and she was using less pads and she was having less leakages. So it was just making not just her life, the quality of life improve, but it was improving the carer's quality of life as well. So that was really lovely to see. We got two happy ladies from one course, which was nice.
Yeah, yeah, no, it's
Yeah.
amazing. So I did have a go on the chair myself. So
Yeah.
why don't you describe what it is and then I'll describe what it felt like for me. So tell us how it works.
Okay, so we sort of call it like the pelvic floor throne. There's a little magic chair. We've got lots of nicknames for it thrown around,
Yeah.
but it's a non-invasive treatment for urinary incontinence, and we've also used it for fecal incontinence as well in clinic, and have really good results with that too. Um, it's particularly stress and urge incontinence that we would focus on with that. Um, it's a patented technology to the chair. So it's called HIFEM. So it's high intensity focused electromagnetic technology. And that stimulates the pelvic floor muscles. So you sit fully clothed, very upright with good posture, much better than I've been sitting throughout this,
And
this
me.
session. um, and we position you in the correct way. So you're fully clothed the whole time. You can kind of walk in, walk out. There's no pain or anything associated with the treatment. It's brilliant because people don't need to know that you've had it if that's something that you're worried about. Um, and we do about 6 sessions. You can have more. I always like to start with 6 and then reevaluate. We do a half-hour session each time. It's 28 minutes. And in that 28-minute session, you do just over 11,000 pelvic floor exercises. So it is an intensive workout, but you don't feel it because it's just stimulating the muscle for you. You don't have to do anything. You just read a book, have a chat, we have a bit of a gossip. Doesn't always
We did all
think
of
once you've
that. We
broken.
did all of that when we had to
Yeah.
go.
Yeah, and again, once you've spoken about something that I think it's one of the last taboos, continence issues, it's really something that people can be quite worried about talking about. But once you've talked about it, there's not much you can't talk about. So you have some really lovely conversations and you really get to know people, which is brilliant because you see them so much over a couple of weeks too. You see them twice a week for 3 weeks. So it is brilliant. You
And that's
meet
what
some
I
lovely
tried,
people.
isn't it? I had to go
Yeah,
on it. I didn't have the
you
full half
tried
an hour.
that one, yeah.
Yeah, and it was amazing because Kate was able to, she was asking questions about what it felt like. And I can just only tell you because it went through cycles, didn't it, Kate?
Yes, yeah. So it warms the muscle up, it contracts the muscle, and then throughout the period of time as well, it's also tapping the lactic acid out of the muscle, which means
Yeah.
you're not going to get that DOMS that you would traditionally get after going to the gym. So you're not walking around with any muscle soreness, which would be awful, really. It would be really
And I
pleasant.
said to you that was a big concern for me because I really do suffer with that. And so it was bizarre. I said it was like
Yeah, there's no, yeah,
it was bizarre. But I'll tell you what it did remind me of. Back in the day, I used to have one of those belts that goes around your tummy to try and tone your abdomen muscles. It was like that, but about, it was 10 times more
yeah,
comfortable. I was able to have a conversation. And actually, once you got used to the cycling, you were like in it. But the next day I did feel like everything had lifted.
you do see really,
I
yeah,
feel like I felt like it had knitted together more, and it was a really nice feeling. It was a feeling of like certainty. I felt just more together. Everything
yeah,
felt stronger, and that was I really didn't have that long. I think I had 10, 12 minutes, something like that. But it was
yeah,
really powerful to feel. But like you said, it's not like you had any downtime. It's obviously doing something, and I could see how over a number of weeks. I mean, how long does it last after you've completed your sessions?
yeah. So you do like the 6, say, and you do that over 3 weeks, and then we send you away for 4 to 6 months. We say we don't want to hear from you. No, we don't. We keep in touch. I always say pop in if for a drink if you're in the area.
Yeah.
Um, but they go away for however many months, and then they come back and they have another session that we do for them, and that's because we want to see you guys again. We want to get in touch. We want to see how you're getting on because over those months it's improving. It's not a case of you do the 3 and then you have to do another 3 weeks again, another 3 weeks again. If you maintain it, you should never have to do an intensive course again. Everyone's
Yeah.
pelvic floor strength is different and everyone's lifestyle is different. Like we've spoken about earlier, there are lifestyle changes that you can make, and if you don't make those or you have to make more of those, then we have to address things differently because this is never something that I would say you kind of one and done. It's not a
Yeah.
case of having the Emsella will sort all of your problems. It's part of a treatment package plan that we can come up for you with I things that we can look at like the estrogen cream and things like that. It's
Yeah.
it's not a case of just having that. But yeah, so you would do got really sidetracked, sorry. So you you do your monthly review after you've done your intensive course. And then after that, I expect to see people. I normally get some one session booked in maybe 4 months later. And I always say, if you don't need it, push it on, but keep it in the diary so that you can check in with yourself. How am I getting on? Have I let things slide? Am I thinking about buying pads? How is this going for me right now? Okay, actually, I'll have it. Or no, I don't need it. Everything's going well. I'm still running. I'm being active. I'm talking to my grandchildren. I'm taking them out on days. I'm not worried when I'm driving. I'm not looking to see where the nearest loo is. I think these are all things that I'm really commonly hearing that
Yeah.
people aren't having to do anymore. So if they aren't still doing that, then it's brilliant. Push it on.
That's
Yeah, everyone's
amazing.
different.
And so is it that you need to be doing some of those Kegels, pelvic floor stuff in between, or really could this stand alone uh, on its own merits and, like you say, putting all those checks and balances in place?
So, because it's rewiring the pelvic floor's like kind of neural pathways to the brain, because it's doing that massive muscle engagement, the brain's so much more aware of it. Whilst you're doing the 6 sessions across the first 3 weeks, I don't actually advise people to do the pelvic floor exercises at home because you're doing such an intensive workout. You've got to give the muscle time to repair itself so that you can see that muscle growth. I would say to look at maybe doing some pelvic floor, some abdominal exercises like we discussed earlier, because that will reinforce the results without tiring out the same muscles.
Yes.
But during the time after they've done that intent, like the 6 sessions, absolutely, they'll have so much more control over their pelvic floor now. If they want to go and try and do their own training whilst they're at home, that's something that they can do. I get some people that don't. It's personal. It's a personal decision.
Exactly. And so how does that then feed into the MFEM 360 that you told me about?
Yeah, so we had a bit of a look at this, didn't we? And they use different technologies. So EmFemme uses radio frequency to stimulate collagen production as well. And that it's a completely different technology to the Emsella actually. Yeah, I'm thinking in my head about that they're by the same company and they've got silly names, but they aren't the same at all, even though
No.
you might think so.
Yeah.
So the EmFemme, it's a newer version of a machine that I was used to using as well, but the technology it's just improved. It's gone from here to here. It's just amazing what they've done now. It's naturally plumping and producing hyaluronic acid within the cells as well. So you're
Okay.
getting much more hydrated, much more happy cells, which means so any atrophy that we're having, it helps to replenish that and produce estrogenized like cells. So you're getting a much more moderately acidic pH, which is where we should be sitting, and we're seeing improvements in flora as well because
So
we're
what
just getting a much more happy environment.
so is it something that's inserted inside here, or is it something that also works on the outside?
Yes, it does both. So we have the internal treatment is 8 minutes, so it's really quick, and you only do three. You do one treatment a week for 8 minutes, and that it you go. You do it's like a little internal probe, and it's got a temperature monitor, so I can check that you're at the right levels of temperature. And that's producing more collagen and elastin, and that's helping to help with any urinary incontinence as well as any laxity too, because it's reinforcing and it's strengthening that vaginal canal.
Yeah.
So again, it's painless too, and there's no downtime. There's nothing you can't do. I am aware that some people have been told that they aren't allowed to have sex 4 or 5 days after a treatment. It's not the case at all. It doesn't impact anything. So it is, you can just carry on with your life as normal with anything like this.
Yeah.
It
I bet.
doesn't impact the cells.
Yeah, amazing. And I'd just like to touch on the whole pH thing because I hear a lot of people who actually can go the other way and get what we call lactobacillus overgrowth. They call it cytolytic vaginosis. And that can
Yes.
make things feel quite acidy and burny. So, it is really important as a symptom marker that actually, if you're getting that sensitivity, it's probably
Mhm.
likely the pH is changing. It's probably like the vaginal microbiome has really changed because the acidity, the pH changes as we navigate our way through all the stages of menopause. So, again, it's not like keep calm and carry on and suffer. These can be prompts, literally, that the change in pH can stimulate that bladder receptor, which makes you feel like, oh, I need to go. And actually, it's not nothing to do with that. It's actually a
No.
sensitivity issue, isn't it? So,
Yeah.
okay, so that's also I didn't try that one, but I saw the
No,
probe.
we didn't get around to that one,
Didn't
did
get
we?
around to that. We weren't there that long.
No.
So then I guess the last thing that you were sort of telling me about is the Emsella Embody core to floor, which I like the sound of. How does that all
Horse
work?
floor. We like a bit of rhyming in this country, don't we? It works very
Yeah.
well. Yeah. So the quarter floor, it's sound of as it sounds, the core muscles and the pelvic floor muscles. They've just gone for the rhyming element.
Yeah.
And we take the same technology that we use on the pelvic floor muscles and we apply that to your abdomen. So again, you get this time though you get an aesthetic benefit because obviously you can see the increase in strength in your abdomen muscles. You can't really see that in your pelvic floor. Although they do have a really good scan of someone's pelvic floor before and after, and you can actually see the thickness increase of the pelvic floor muscles,
Right.
and you can see the laxity. Yeah, it's really good. I have to make sure you've got that because it's very interesting.
Yeah.
Um, but for the quarter four, you can see the definition of the muscles, but again, that strengthens the just the connection between the core and the pelvic floor, which really just helps to reinforce the results. I never think with any sort of combination therapy that you have, whether you do EmFemme, Emsella, the quarter floor, or you combine it with any medications or anything else that you do, it's not a case of you get the results of A and the results of B. you get the results of A and B, but together they work together, and your results are just tenfold from that. The combination of having any sort of treatment like that just means that you get off the chart results. It just works so much better
Yeah.
rather than taking it as a single thing. So that's kind of the theory behind the cords of floor, is that by having the two, you're just really reinforcing that strength.
And I
So
think what's
you
really
just, yeah,
important, which you're always sort of saying, is, it can be very difficult for people to access, like you were saying, people can come plan in their own time when this works for them. You're very, very encouraging to try lots of the lifestyle stuff. You said there's a place for all of it. And I really liked that approach, because it's not like, one and done in that sector and that's it. I really liked the fact that as a, CQC registered clinic, you are doing an amazing job of looking after people, and yeah, if people want to be in work, then actually it's not so easy to get an appointment, trying to access this stuff, it's just not available on the NHS. But the reality is, with the service that you're offering, people can fit it in during their lunchtime, they can fit it in after work, on their way to the gym. And actually, I think
yeah,
that is a really positive option for people. I mean, I know clinics generally maybe some people are scrutinizing them, but what I would always say is not all clinics are the same. And we're aware of some amazing clinics doing amazing work. And it was really lovely to come into the environment. It was a really beautiful environment, very, very welcoming. And it's a lovely experience, is what I'm saying. Obviously not everyone can access that, not everyone else can afford it, but I think it's an important part of the conversation, that actually, particularly for like that person that you described, who disability, the impact that it has had on their carer, is enormous. And I think the thing that maybe is the most powerful thing for people to take away is that actually you don't have to suffer in silence, because this is the sort of
absolutely.
stuff that can really affect people's levels of intimacy, that then knocks on the door of how their relationships are, your levels of confidence. You know, there's a whole psychology piece around this, isn't there, Kate?
Yeah, it makes such a massive impact into people's lives. And obviously, this is a podcast for women in menopause, but there is an element of men with pelvic floor issues. A lot of men don't realize they've got them, so they don't even know that there's anything that they can do. But obviously, if you have a male partner that's struggling with anything like that, this information, like with the pelvic floor exercises, applies to him too,
Yeah,
um,
completely
which is worth
relevant.
sharing. You can have a little bonding moment over trying to do your pelvic floor exercises
Yeah,
together.
yeah,
Uh,
exactly, because we do go through this together, whatever our partnerships are. And so
yeah,
as we sort of come to a close, then I suppose that the question to ask is, what do you think we need to do? Because many women are embarrassed to talk about incontinence at any time in their lives, and like you say, we've sort of normalized it, like it's okay, just buy a pad. How do you think we can help people to feel more comfortable, and how can we break that stigma? What do you think we need to do?
I think there's an element of education. It's not, I think people associate sometimes continence with definitely an older generation who and they see it as something that's completely uncontrolled all of the time. But I would say if you're declining a drink because you think you'll have to run to the loo, that's a sign to me that your pelvic floor isn't as strong as it should be. And just having those open conversations can make people feel so much more comfortable, because you aren't alone. We're not, it's not just one person that has these issues, everyone does.
Yeah.
I mean, I don't mind. I don't mind saying, but when I was 8, I laughed so hard that I had to run to the loo. And on the way to the loo, I fell over and broke my elbow. So, and I was too embarrassed to tell anyone that I was running to the loo, which made the whole ordeal very difficult. And if I'd have just said, I'd have had a much more easier afternoon, and I wouldn't have felt like I had to run away, and I wouldn't have
Yeah.
broken my elbow. But yeah,
What a powerful
um,
story, because I think we're all doing things like that to manage, aren't we? Whether it's stuffing
yeah,
our bag with more products and various things, or like you say, self-managing, hiding, strategies, or taking all our strategies with us. And
yeah,
it's a lot of stress for people, isn't it?
yeah.
And so that just adds to it. So I love that you've said that. So how can people find out more about what you do at the Nantwich Clinic? Do you have any socials or a website that people can go to?
Yeah, so on all social media platforms, well, LinkedIn, Facebook, Instagram, and TikTok. Actually, we've done a couple on there. We're not as good as it maybe as we should be,
Yeah.
but we're just literally just the Nantwich Clinic. If you want to speak to any of us about anything that we've spoken about today, or anything else that we do, you can give us a ring if you want. I'm always around. I never leave sometimes.
Yeah.
But yeah, I'm always here. So you can find us online too. So we're just the nantwichclinic.co.uk. But yeah, more than happy to have a chat with anyone about anything that they're going through or going experiencing with this.
Yeah, no, it's absolutely brilliant. You've got a
Mm.
really beautiful room there as well, where you do lots of events and stuff, and you get people together, which is, such a beautiful space. And it's very, very welcoming. I'm sure you can gauge through this podcast just how warm Kate is. It's a family affair at the Nantwich Clinic because your
Yes.
mum's there as well, isn't she?
Yeah,
So,
my dad.
and your
Yeah.
dad, yeah. So
My
it's
dad's
amazing.
very open. Yeah, he's used the Emsella. He talks about it all the time.
Yeah. Well, maybe we should get your dad on to talk about it.
I think
That would be
maybe, yeah.
amazing. That would be amazing because I think that's the thing. Lots of men go through difficulties, and we haven't talked about the andropause, but the andropause affects men as well. So,
Yeah.
it's very, very similar issues. Well, it's been
There's
an
so much to talk about. We
Oh,
can't
I know. We just definitely get you back. We
keep
definitely
going
get you
all
back.
afternoon.
Exactly. But it's been so lovely to have you on, Kate. Thank you so much for your time. Thanks to your mum as well for generously sort of showing us, telling your stories, letting us have a go on the equipment. And I, for one, really, really feel that there is a place for that. And I think it's about do your homework, go to the clinics that are CQC registered, find out, look at reviews, see how happy people are as they certainly are at the Nantwich Clinic. So for now, Kate, thank you so much for your time.
No, thank you for having me. Really
Oh
appreciate it.
no, it's been an
Been lovely.
absolute, yeah, been an absolute pleasure. So thank you.
Thank you.